Okay, lung cancer. Lung carcinoma, of course, here you're talking about now malignant tumors. I know you've done this from your pathology. So, malignant tumor of the lung, usually characterized by now uncontrolled cell growth. And of course, if left untreated, of course, can spread beyond the lung. We know the process of metastasis from your pathology, where it gets now to spread and affect other tissues and organs of the body. So we have the classification or the main types of lung cancer. We have the non-small cell lung cancer, and we have the small cell lung cancer. And talk about non-small cell lung cancer, the most common of the two types, counts for the larger percentage of the cases, usually gets to arise in the outer region of the lung. Can present like pneumonia when you do a chest x-ray, very common in women. And then the small cell, most aggressive, rapidly grows in men's size within the body, and mostly related to cigarette smoking, and it's very, very aggressive, even from the early stages. Now, of course, the main causes of lung cancer, the tobacco smoking, second-hand smoke, air pollution, exposure to asbestos, radon gas exposure, air pollution, occupation exposure, family history can all cause that. The clinical manifestation, coughing that worsens, sputum production, chest pain, hemoptysis, hoarseness of the voice, weight loss, loss of appetite. These are symptoms that you are familiar with. Infections, fatigue are some of those symptoms of lung cancer. The stages, of course, this you've done this in your pathology. The stages of the cancer. T0, that is tumor 0, there is no evidence of primary tumor. T1, tumor is no larger than 3 centimeters. T2, the size of the tumor. Basically, this is staging based on the size of the tumor. Then staging based now on the involvement of the nodes. I know you have this from your pathology. Then now metastasis, categorizing now the metastasis of the lung cancer, M0, where there's no spread to distant organs, M1A, that's cancer spread to the cancer spread to the lung, M1B, cancer spread to distant lymph nodes. Basically, that is now the classification. Of course, it was discussed in detail in your pathology class. Of course, the pathophysiology of lung cancer, we know that repeated exposure to carcinogens, etiological factors lead to damage to the cell, more especially the DNA of the cell. So that carcinogen binds to damage the cell DNA. There'll be cellular changes, abnormal cell proliferation comes in, which leads now to formation of a tumor, and then now becomes malignant, gets to spread either via direct invasion, by lymphatic spread, or by mitochondrial spread, like to organs like the liver, the brain, the adrenal glands, and such. So to diagnose lung cancer, medical history and physical exam, where you want to look at the history of the presenting illness, the coughing, the sputum, the hemoptysis, you want to look at that. Blood tests, complete blood count, blood chemistry, liver function tests, are some of those tests that you can do, blood tests that you can do to confirm or to rule out. Chest x-ray, which will show you mass should show you the tumor. CT scan can give you a detailed evaluation of the tumor. CT guided needle biopsy, which will help you to get a sample of the lung tissues for examination. FNA, that is the fine needle aspiration, again helps you to get a sample just for examination. Of course, some of the interventions like the laser therapy, which helps to treat very small tumors, direct intervention. Chemotherapy, we are familiar with this. We give the chemotherapeutic drugs just to manage that. These are some of those chemotherapeutic drugs and the side effects which you need to now educate your patient in your nursing interventions. The hair loss, the mouth sores, loss of appetite, nausea and vomiting, diarrhea, constipation, bruises, are some of those fatigue, some of those side effects are associated with the patient undergoing chemotherapy. Surgical intervention, which is a treatment of choice, more especially for the early stage of the lung cancer. Lobectomy, where the entire lobe that has that tumor is removed. Segmentectomy or wedge resection, a part of the lobe is removed. Pneumonectomy, where the entire lung is removed as your surgical intervention. So wedge resection, segmentation, lobectomy, a whole lobe, pneumonectomy, the entire lung. We have others like the video-assisted thoracic surgery, where now small incisions are done with the assistance of video. So placed through a small cut inside of the chest to help now the surgeon be able to see the inside of the chest on a monitor. So it is a less painful type of surgery and patient usually has lesser stay in the hospital. We have the radio frequency ablation, where we use now high energy radio waves to hit the tumor. And uh, basically, once you've hit the tumor, you destroy the cancer cells. The only complication is that it can lead to partial collapse of a lung, or it can lead to bleeding in the lungs. Your nursing care of this patient, of course, monitoring the respiratory status, signs of respiratory failure, administering those chemotherapy drugs and other desired drugs for the patient, respiratory assessment, educating the patient, the disease, the progression, the side effects of the treatment, facilitating lab investigations under diagnostic tests, assessing patients' anxiety levels, the support system, and providing interventions to address the anxiety levels for your patient. Your nursing diagnosis, there are so many there: pain, ineffective airway clearance, ineffective breathing pattern, altered nutrition are some of those diagnoses. Of course, sometimes patients with lung cancer, these are terminal illnesses, so you need to provide palliative or supportive care. This one is just aimed at improving the patient's quality of life by reducing the symptoms, more especially the pain symptoms. So some of the key things you look at: the physical well-being of the patient, the emotional and coping status of the patient, the spiritual well-being of your patient, and then of course health education to minimize exposure to these cancers. SWALI,